because of all the technology we're about to introduce into the hospital, both in terms of hopefully we'll have a full and comprehensive electronic patient record and the use of things like digital dictation, it's really going to help to transform the way the clinicians work in the hospital. And I'm very fortunate, I've got a number of champions who are really biting at the bit and very enthusiastic about the new systems coming in. I've been in Pennine now just a year, and during that time I've had more requests from clinicians around prescribing than anything else. They view at the moment that this is something that is missing, and particularly when they're trying to do things like discharge summaries and particularly handovers. It's very important that everybody understands what medication patients are on and making sure that they do go home with the right prescriptions. So I'm really pleased that we are actually going to be one of the first couple of hospitals in the country to work with ISOF developing an e-prescribing solution based on a product that's widely used in Australia. We recognise there's going to be a lot of development work involved in it, but I've got clinicians queuing up asking to be part of the pilot. We're hoping to do a pilot in April, May next year, and we're going to do it on a small number of wards to make sure that we understand all the safety issues, but it's got to be an absolute must in terms of patient safety. Certainly, you know, the nurses I'm sure will absolutely love it because it takes them so much time to complete drug charts. The fact that once they've entered it electronically, doesn't matter how long the patient's in for, they don't have to keep handwriting these drug charts out. And certainly one of the biggest complaints you get from nurses is they can't read the doctor's handwriting and they're constantly trying to ring round, and the pharmacists are the same as well. So, you know, the Trust is very, very excited about the e-prescribing, and we see it as a very key element in helping us to improve patient safety.